The COVID-19 pandemic unleashed a dramatic economic collapse and humanitarian catastrophe in India. However, the most destructive outcomes did not result from the trajectory of the disease, but from the nature of the government response. Early into the pandemic, the Indian government imposed a national lockdown that was the most stringent in the world, with curfew-like regulations confining people to their homes, preventing most economic activity, and prohibiting movement other than for specified errands. This draconian closure delayed the virus transmission, but did not control it. At the start of the lockdown on 25th March, the country had only 320 cases and 10 deaths from COVID-19 in a population of more than 1.3 billion. By the end of June, India had become the third worst affected country in the world, just behind the US and Brazil, and on course to overtake them with around 20,000 new cases reported every day. The disease continues to spread exponentially. What explains this unfortunate combination of failure to control the pandemic along with extreme economic distress? The concept of accountability for all of the problems that the Indians are facing. What is the notion of political accountability? There's a need to look at the circumstances that led to these consequences. In February, you had the ruling BJP party virtually declare victory over the pandemic under the leadership of Prime Minister Narendra Modi. In early March, when you had surges being reported from some districts in India, you had the health minister say that the coronavirus pandemic was in its endgame in India. The government allowed mass gatherings for religious festivals, for political rallies, till as recently as a week ago. And with that messaging coming from the top, you saw people on the ground becoming complacent as well, not following COVID protocols, even though in India we could see that the second wave of COVID-19 was more deadly. Basic things like stocking up on oxygen supplies, stocking up on medicine, ramping up medical facilities was not facilitated. In fact, during the first waves, there were some field hospitals that were built up. Those were actually dismantled in the second wave. And so, now India finds itself in this position where it is trying to rush in oxygen to places where there's a shortage. There's aid coming in from other parts of the world, but this crisis is unfolding on the ground at such a rapid speed that this help is not getting to people in time. There are people dying today who could have been saved if they had oxygen in time, if they had a hospital bed in time. So how is the virus mutating, and what do we know about the variant? The picture is different in different parts of the country. In Delhi and Punjab, the UK variant is dominant. It has a mutation to the spike of the virus that allows it to enter cells more easily, so it can infect more people. But in West Bengal, an Indian variant has emerged. It has 2 key mutations. Lab study suggests that it is slightly more infectious, but less so than the UK variant. But the changes may mean that antibodies find it harder to block the virus. Scientists need to assess how much immunity is lost. COVID cases in India have been rising steeply, as we know, over the past few weeks. And with that increase has come the inevitable increase in death. In this period of uncertainty and unpredictability, the Red Cross staff and volunteers across the world have been on the front lines to save lives of people affected by the unprecedented pandemic. The ICRC regional delegation based in New Delhi is closely working with the Indian Red Cross Society and the International Federation of Red Cross and Red Crescent Societies to deliver a unified response to prevent the spread of COVID-19 across the country. Thousands of volunteers of IRCS state branches are working tirelessly in the districts across the country. They are delivering health and sanitary resources as well as essential food items. They are proactively engaged in dissemination of information on disease prevention and health education, covering frequent hand wash, respiratory etiquette, social distancing, use of alcohol-based hand rub, and masks, among others. There is a need for action and organized campaigns to save children from coronavirus if they are at increased risk. The priority now is to get medical care to the sickest. But there's also an urgent need to reduce transmission, because if the virus is out of control in one country, it is likely to spread to others, and these are ideal conditions for the virus to evolve. The way to limit viral variants to be emerging in the first place is to prevent the virus replicating in humans. That's when they get the chance to mutate and arise. So the best way to control variants is actually to control the amount of disease that we have at the moment.